Hello, my name is Abdul Maalim. I live in Seattle, Washington. Today, I'm going to be joined by Dr. Anisa Ibrahim to talk a little bit more about coronavirus vaccination and all the resources that are available out there for everybody who needs to get vaccinated. Without any further ado, I would like to get right into this conversation.
Hello, my name is Anisa Ibrahim. I'm a pediatrician and the medical director of the Harborview Pediatrics Clinic. And I also do a lot of community-facing educational and health disparities work.
It's really nice to meet you. And thank you for volunteering your time, honestly.
Absolutely.
So can you give me a little bit of background of what you deal with on a day-to-day when it comes to like the whole COVID situation?
Yeah, so I think that I work with a very diverse patient population in clinic, and what we've seen from the beginning of the pandemic until now is that communities of color, specifically Black communities and communities that live in South King County, are significantly more affected by COVID than the other population. I think this is due to a lot of issues. It's not just that people of color are inherently more susceptible to COVID. It's a lot of systemic and institutional racism. It's a lot of where they live, access to education, access to health and healthcare, and the information needed to keep our communities safe. So on a day-to-day basis, I see a lot of children, and as a pediatrician, I'm meeting with children and families, and almost all of them have been impacted by COVID in one way or another. Sometimes it's health impacts, other times it's loss of jobs, loss of family members, lots of school and opportunities. Many parents are out of work, so it's had profound impacts in the community.
So can you tell us a little bit more about COVID-19 vaccination and where people can get vaccinated or get tested?
Yeah, absolutely. So I think, there's many places around the county that you can get tested. There's many different sites, and some are through public health, some are through Seattle King County. In further south, there are some places by, like in Tukwila, CHI Franciscan. All of these are kind of either walk-up or drive-up testing sites, and you can get the appointments online. Overall, unless it is, a holiday time, or a lot of people are expected to get testing. Testing is relatively easy to access, but it does vary based on how many people are also trying to get tested. So around the holidays, it's a lot harder to get tests. Another resource is actually really going to your doctor's office and asking them where they recommend getting testing. Some doctor's offices are doing testing within their clinic. Others have a routine place that they ask their patients to go and get tested. Big hospitals like Harborview have their own testing site where you can go and get tested. I think testing for COVID-19, if you have any symptoms, right? A lot of people, it's hard to differentiate between symptoms of a common cold and COVID-19. That overlap is significant. So I would, caution and urge everyone to err on the side of getting tested. If they have symptoms, get tested. Don't think it's just a cold. Don't think that you're just going to get better, which I hope is true, but you do have to be very, very careful because that's the way that COVID-19 spreads. People who don't know that they have it are, spread it. And then outside of testing, there are, mitigation strategies. So this is why we continue to say, even though we're urging people to get vaccinated, this is why we continue to say, please wear a mask. There's still people in the community who cannot get vaccinated, right? For example, my 20-month-old child, he's not eligible to get vaccinated. And me masking when I'm out is protecting him as well as other people who cannot get vaccines for medical reasons. And that will help stop the spread of COVID and protect the people who are most vulnerable. Social distancing is the same thing. And then the single most powerful thing that we really do have to stop the COVID-19 pandemic, essentially address it essentially give us the ability to really protect everyone is the COVID-19 vaccine. I think the vaccine has been proven to be safe. It's been proven to be effective. There are now millions of people in the United States, over 200 million people in the United States have gotten this vaccine, and all of the safety measures have been followed. So the vaccine is really the best way to protect yourself from getting very sick, from getting hospitalized, dying from the COVID-19 infection. And then vaccines right now are free, right? There are many places, there are many free vaccination sites all around the city. There are many health boards that are teaming up with public health, the Department of Health. Vaccines are being given out through schools, specifically right now elementary, middle, and high schools, where you can get vaccinated at your child. You can get your children vaccinated at your child's school. And then for adults, pharmacies, many places. And there is a website called Vaccine Finder that you can put in your zip code and figure out where to get vaccinated. It's safe, it's effective, it's free, and it's really the single most important thing you can do to keep yourself and also your community safe.
Can you tell us a little bit more about who are eligible to get vaccinated, age groups, and a little bit more about the boosters?
Yeah. So currently, I'm very, very happy to report that everyone 5 and older is eligible for COVID-19 vaccines. I think the children 5 to 11 were the most recent group that was approved by the FDA after the vaccine, met all the safety and efficacy measures. So anyone 5 and older can get the COVID-19 vaccine. Now, I think in the age group 16 and above, there's many adults who are now eligible for a booster. Now, a booster is not something that is just specific to the COVID-19 vaccine. All of our childhood immunizations had boosters, right? We took 2-3 doses of, for example, the polio vaccine or the tetanus vaccine. So it's something that we do to continue to keep our immune system, keep our bodies well protected against COVID-19. If you are now 16 and older, almost everyone at that in that age group is eligible for a booster. So you can just look at your local guidelines and see whether or not people are eligible. The FDA has approved boosters in everyone 16 and older. And the youngest age group is really the only one that's not eligible for vaccines yet. I hope in the next 6 months or so, hopefully even sooner than that, that the 5 and under age group will be eligible to get vaccinated as well. But currently, everyone 5 and older is eligible to get vaccinated and to get a booster. And then boosters are very important because as our immunity wanes, we need to get vaccinated so our immunity can increase again so we can have the best protection against the virus.
So can you tell us a little bit more about the preventative measures that we should be taking to combat the spread of COVID-19?
Yeah, absolutely. So again, I think the single most important preventative measure to combat COVID-19 is the COVID-19 vaccination. Outside of the vaccine, I think there are many things that we learned during the pandemic that are very effective at mitigating. So that's called a mitigation strategy. And these include continuing wearing a mask. Continuing to avoid large gatherings, especially if people are not vaccinated. Frequent hand washing and just ensuring that you are social distancing. So the ability to kind of space people out is really important. And this becomes even more important as people are traveling, having holiday gatherings, etc. You are increasing the risk if you are gathering with people, especially people whose vaccination status you don't know. So I think I would say that those are the biggest kind of prevention and mitigation strategies: hand washing, masking, sanitizing, and then avoiding large gatherings, and then vaccines.